Welcome everyone. Please give me a thumbs up or type it in the chat box if you can hear me, so I know if my audio is working properly here. Thank you for joining our FSA webinar. We have our P&A representative joining us along with our very own from SFHSS, who will be happy to answer your questions through the Q&A comments box. Your microphones will be muted during the entire webinar. We encourage you to ask questions through the Q&A box in your menu bar. The presentation has been pre-recorded to allow our representatives to focus on answering your questions. At the end of the presentation, you'll be able to hear our representatives answer your questions from the Q&A box. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF My Hub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF My Hub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Welcome to the City and County of San Francisco's FSA Open Enrollment. What is a flexible spending account? A flexible spending account is a pre-tax savings account that utilizes pre-tax dollars on eligible items. When you enroll in the plan, you save on federal, state, and FICA taxes, which decreases your taxable income and increases your take-home pay. How the plan works. So right now you're going to decide how much to set aside into your Flex account by estimating any predictable expenses that you have forthcoming for the next plan year. You're going to enroll during your employer's open enrollment period. And then your annual contribution is divided by the number of paychecks that you have throughout the course of a full plan year. And it is deducted pre-tax and put into your FSA plan. Here's an example of how the plan works. So let's say you elect $800 for the plan year. You have 25 paychecks, so the amount that you have withheld per paycheck is $32. You have two accounts available to you. The first is the Health FSA. This covers any out-of-pocket medical, dental, and vision expenses that you and any of your eligible dependents may have. The second is the Dependent Care FSA. This covers any daycare centers, babysitters, after-school programs, daycare programs, and elder care facilities. The first account is the Health FSA. There are a few rules with this plan, the first being that your full annual election amount is available to you on the first day of your plan year, so you don't have to wait for those funds to stack up. They are readily available for your use. Once you are enrolled in the plan, you're only allowed to change your election amount if you have a change in family status. And then you do have a carry forward rule, meaning that you can carry over anywhere between $10 and $660. Anything below $10 will be forfeited, and anything above $660 will be forfeited. The maximum you can contribute to this plan is $3,300, and the minimum is $250. Here are some examples of eligible items under this plan. Things like copays, deductibles, dental work, eyeglasses, over-the-counter medications, and prescription costs. This is not a full extensive list of the eligible items. If you would like to view some more, you can do so by visiting our website, or you can visit the FSA store. It is also a great reference tool that you can not only shop around on, but also utilize this to reference any items that you may be seeking. The Dependent Care FSA. So this account is a little bit different. It is considered a pay-as-you-go account, meaning that you do have to wait for those funds to be withheld through payroll in order for the account to be funded. Once you're enrolled in the plan, you cannot change your election amount unless you have, again, a change in family status or a change in daycare needs. This plan is a use it or lose it rule, meaning that no funds roll over. The maximum you can contribute to this plan is $5,000, and that is a household maximum, and there's a $250 minimum. Here are some examples of dependent care eligible items, things like after-school programs, caregivers for disabled spouses or elderly dependents, daycare centers, day camps, overnight camps are not allowed, elder care facilities, as well as nursery schools. When you enroll in the Health FSA plan, you do receive a benefits card that is automatically activated upon first use, and it is valid for roughly 3 years from the date of issuance. If you need any additional or replacement cards, you may order them through your P&A account online, and there is no charge for any replacement or additional debit cards. How to submit claims. So for manual claims, you can do so by using our mobile app. We do have a computer desktop website, or you can fax or mail claims to us directly. Claims reminder for the health and dependent care FSA plans, claims are due by March 31st. And then again, you can only carry over between $10 and $660 in the health FSA plan only. Any amount exceeding that will be forfeited. Getting reimbursed. So you do have two options available to you. The first is direct deposit. This is the easiest and fastest way to get reimbursed. If you do not enroll in direct deposit, you can receive a mailed check to your home mailing address. Just to be cognizant that there is a $25 minimum threshold in order for a check to be mailed. The P&A mobile app. So if you are going to be utilizing the plan, I do strongly encourage you to download the app. This is a very user-friendly tool. You can register for various different account alerts, submit claims, check account balances, upload debit card documentation, and then you can also utilize the Easy Scanner that we have on there. If you're at the point of purchase, you can pull up the Easy Scanner and scan a barcode of an item, and it will tell you if the item is eligible or not. Here are just some snapshots of what the app looks like. So again, there's all these different alerts that you can toggle on and off and customize the experience however you see fit. Customer service. We are available Monday through Friday, 5:30 a.m. to 7 p.m. Pacific Standard Time. We do also offer online web chat, and then our phone numbers are displayed on the screen. Penny the Panda. So if you are needing some further education on an FSA plan, please feel free to visit our YouTube page. And there are a lot of different Penny the Panda video tutorials that offer lots of helpful tips. Thank you.
At this point, we will now begin our Q&A session. I'd like to ask our representatives to turn on their cameras and answer the questions our members have been sending in the Q&A box. I want to remind our members that you can still send your questions by typing them in the Q&A box. Look for the Q&A box in the menu on the top or the bottom of your screen. Please do not share any personal medical information, as everyone will be able to see it. We will be ending this webinar promptly at the end of the hour to allow our representatives to support our other members, and I will give a 5-minute mark before it ends. So let me go ahead and start at the first question that was asked here and reread them so it can be recorded. First one is from Catherine. I see that there is a new limit on how much you can set aside in a flexible spending account for the dependent care, and the cutoff is 160,000. Is that based on how much you make at the time of the election, like January 1st? Or what happens if you get a raise or cost of living adjustment that puts you over that amount, but you weren't aware until the middle of the year after you have made the election for the higher amount? And Sonali, if you could share your answer with us, please.
Sure. Hi, Jay. Hello, everyone. It is based on what is in the system during enrollment at this time during open enrollment. But during the year, if there is a need for correction, HSS will get in touch with you in writing if there is a need for an adjustment. But for open enrollment, it is based on what's in the system currently.
Thank you, Sonali. And if you need more clarification, you can always type another question after that. Next question is from Chris. Just to clarify, the max contribution is 3,300 pre-tax. That means our FSA account will have 3,300 to use for the 2026 calendar year. I plan to use it for my child's orthodontics. And Victoria, you answered that one. If you could re-answer that again, please. Thank you.
Yes, so the maximum for 2026 is 3,300 for the health FSA. Again, that is a pre-tax selection amount, and orthodontics is covered.
Thank you, Victoria. Next question is from Miranda. Is the dependent care max 5,000 or 7,500 for plan year 2026? And if anyone can answer that for us.
I can answer that. So if the income is below 160,000, it is anywhere. The minimum is 250. The maximum is 7,500. If the income is above 160,000, then the minimum is 250 and the maximum is 3,000.
Great, thank you, Sonali. And Purva asked a question: what was the carryover amount? And I guess they are asking for the FSA carryover amount for 2025 to 2026 to 2027 would probably be, I'm guessing that that's the question.
Yeah, so it's $660.
Okay, so it's 660 for carryover for planned pay period 2026 to the 2027. And again, I'll drop all that information in here so it's not so confusing. The next question is from AJ. If you are a 2-income household with no dependents, can you use the FSA money for relevant costs for the non-employee spouse, or does it require that they be added onto the employee's medical plan?
So this is completely independent from your medical insurance plan. So it is for you and your spouse. They do qualify under the FSA. So the answer is yes, you can utilize your funds for your spouse, who is also considered a dependent, and they do not need to be on your medical plan. Their out-of-pocket costs would still qualify.
Thank you, Victoria.
Mm-hmm.
Next one is for Margarita. Is our FSA contribution limit different from the limit per IRS. And Sonali, if you can answer that one for us, please.
Can you repeat that question one more time?
Is our FSA with SFHSS contribution limit different from the limit per IRS?
I believe so, because we need to get it approved by the board. So we are 1 year behind every time. Jessica, would you be able to answer that? If there is more to
Sure,
add to
happy
it?
to. Which question is this?
This was from Margarita. Is our SFHSS FSA contribution limit different from the limit per IRS?
Yeah, so we are usually 1 year behind, because by the time the FSA posts their new contributions, we've already put out all of our plan materials and we're into open enrollment. It's usually towards the end of October. And so that's why we use the previous year's FSA contribution limits. So if you do see a difference, that's why.
Yeah. This year, the IRS, they announced it quite early, which was a little bit shocking even to P&A. So that's why if you see a different limit online right now, that's why. Typically, it's not even been released yet. It usually doesn't get released until November.
Thank you all. Next question is just confirming the previous question earlier. Just to confirm, can you confirm that the FSA funds can be used for a spouse's eligible medical expenses?
Yes, they can be.
Thank you, Victoria. Next question is from Yuming. How many years could be carried forward if the remaining fund of $660 is not used in the plan year 2026? As we know, it can carry forward to plan year 2027. And what's the instruction after plan year 2027 if it's not used in plan year 2026?
That was a mouthful. I understand the question though. So, yeah, this question gets asked a lot. So to clarify, the carry forward is always an option available to you. So if you carried over funds from last year, once you get to the end of this plan year, anything that you have from your new year balance and your carryover funds are looked at as one whole collective dollar amount. And then at the end of your runout period, we determine how much you have left, and you can carry over again up to that maximum of $660. So ignore the fact that the runout or the carryover is from last year or the year prior, whatever it may be. Every year, that's an option to you. So every year you can carry over up to $660 or whatever the new carryover limit is. So it doesn't matter what plan year it's from. It's just always an option on your plan.
Great, thank you for clarifying that, Victoria. And our very own Jessica had dropped in the link for our FSA information for SFHSS, and that is sfhss.org/flexible-spending-accounts-FSA. And if you haven't visited that page, it'll tell you how the FSA works. It'll tell you about healthcare flexible spending accounts. It tells you about dependent care assistant flexible spending accounts. It also has a list of eligible expenses for reimbursement on there, as well as brochures and forms for you to read. And another question just came in. Can you provide an HSS email address for any follow-up questions regarding FSAs? Fortunately, we do not provide any email support, but you can reach us at sfhss.org/contact-us. And let me see if we have any more questions. Another question had come in from Margarita. If an item is listed as FSA eligible on the FSA store website, can we purchase that exact item from another source, like a physical store for a lesser price, and submit an FSA claim for it?
Yeah, so you do not have to use the FSA store. I feel like that's a pretty common misconception. As long as the item that you're purchasing is FSA eligible, you can purchase it from wherever you'd like. If the debit card works, that's great. If not, you can submit a claim to us. The debit card does work on an inventory system, so not all stores are coded properly. So just if the debit card doesn't work, it doesn't necessarily mean the expense is not eligible. But no, you don't have to use the FSA store. You can go to any physical store you'd like.
Okay, Victoria. And another question regarding the carryover from Chris. If I have a carryover amount of $660 into the next year, does that count towards the next year's 3,300? So to clarify, am I able to still contribute 3,300 next year in addition to having the carryover amount? It's a good question, actually.
That's a really good question. So, the carryover amount does not play a factor into the IRS maximum that you can re-enroll for. So you can enroll for the $3,300 and also carry over up to $660. So technically, you could have almost $4,000 in your FSA. I would tell you that I wouldn't necessarily keep enrolling for the maximum if you are carrying over that type of a balance, just because, you don't really want like that amount of money just hanging up in your FSA. The point is for you to kind of exhaust the plan. The carryover is just a nice feature so that you don't lose any funds under that 660. So yes, the answer is yes, but again, I wouldn't necessarily be rolling over such a high balance and still re-enrolling for such a high election amount.
Yeah, that's a great point. Thank you, Victoria.
Mhm.
I don't see any questions at the moment, but just wanted to remind everyone that tomorrow at 5 o'clock will be the deadline for selecting your plans for SFHSS. So we suggest if you haven't done so yet, go on your SF My Hub and start making your choices. And if you're still unsure, just go ahead and save them and make sure you submit them tomorrow by 5 p.m. Another question just came in here. From Julia, when using the debit card to pay for a dental procedure, does it usually go through, or may some offices not work and you have to pay upfront, then submit a claim?
So, dental expenses sometimes are a little convoluted. It depends on the procedure, obviously. Things like teeth whitening, that's considered cosmetic, so that's not an eligible expense. But a lot of times dental claims, we do want to see a receipt for it just so we know what exactly it is that you're having done to ensure that it is FSA eligible. So certainly try your debit card first. Again, if it doesn't work, submit a manual claim to us. If the expense is eligible, we would then approve it and send a reimbursement. If it's not eligible, we would provide a letter stating why.
Thank you, Victoria. Question from Chris. Thank you, and I anticipate using all the funds for orthodontics. Since we will receive a debit card, can I use that to pay for it? Are submitting claims only for transactions that do not work with the debit card?
Yeah, so orthodontics should work on the debit card. So again, definitely try your debit card first as you're always kind of forefront. And then if it doesn't work, you can submit that manual claim to us.
Thank you, Victoria. Not seeing, another one just came in. Can you go over the receipt deadlines again? I believe the question is, yeah, when is the deadline to submit the claims? Get the
I believe it's
receipts in.
March 31st for you guys, right, Jessica, if I'm not mistaken? Yeah. So you have until the end of March to submit any claims that you would have had from the prior year. So again, make sure your dates of service have been rendered by December 31st. But then I know a lot of times, doctors' offices, they take a little bit to send those bills in the mail. So you do have those extra 3 months to submit anything.
Thank you. And again, I'm going to drop the our website for the FSA in case someone had missed that.
There's a question
Yep.
here about closing an FSA account.
Can I close the FSA account anytime? If yes, should I use the funds before closing?
So you have to wait for a qualifying event in order to terminate your FSA. So once you are enrolled for the plan, you are locked in for the full year. Unless you have a change in family status. So things like if you were to get married or divorced, if you had the birth of a child, or if you lost a dependent, those types of qualifying events would allow you to adjust your election, but otherwise you would be locked in.
Thank you, Victoria. Another question from King. How far back does the eligible claim for FSA dependent care can claim? Or can we only claim all the expenses that start from January 1st, 2026? The reason why I ask is because we have an expected daycare this year, and it would be helpful if some of the expense can be paid off by FSA. I elected, but only available next year. The school year starts in August, which is different from January 1st, 2026, which makes it difficult to estimate the school year's expense.
Yeah, so unfortunately, the services do need to be rendered within the plan year. So anything that would be on or after January 1st would qualify. Anything before, unfortunately, does not for a 2026 election.
Victoria. Does the city allow Prop F employees to participate in FSA? Anyone can answer that.
Uh, say that one more time. Prop what?
Does the city allow Proposition F employees to participate in FSA?
No, Proposition F means they're already retired. They do not qualify for FSA.
So that's great information. Not seeing any other questions here. Again, I encourage everyone that's in this call to ask any inkling questions since we have our representatives here.
And while we give it a few minutes to see if people want to type in any more questions, I do want to follow up on the member who asked earlier if they should use their FSA funds before closing, and that is yes, absolutely. If you have money in your account and you're thinking about closing it for whatever reason, or that you don't need it anymore, you should try and use your funds, or you will lose those funds. They will not be returned to you.
Thank you for clarifying that. And I also wanted to reiterate what I dropped on here earlier for the different plan years. So for the plan year 2025, the one that you're in right now, any unclaimed funds of a minimum is a minimum of $10 and it's a maximum of $640 in the healthcare FSA that can be carried over to the next year, 2026. And any unclaimed funds of less than $10 and more than $640 will be forfeited. Now for plan year 2026, any unclaimed funds is a minimum of $10 and a maximum carryover of $660 for the healthcare FSA. And any unclaimed funds of less than $10 and more than $660 will be forfeited. And there are no exceptions on those. So there's a slight difference there. Let's see if there's any more questions. What's the difference between an FSA and an HSA? Can we use an FSA to pay for the full orthodontic and plastic surgery treatments at a dentist or doctor's office?
So an HSA, in order to have an HSA, you do need to be enrolled in a qualified high deductible plan, and you cannot have an FSA and an HSA at the same time.
Okay, thank you, Victoria. And just next question is for clarification, is it only $660 that can be carried over per year? So let's say this year I carried over $660 and put in $1,000 for plan year 2026. Would I lose the $1,000 if I don't use it because only $660 will be carried over?
Yeah, so only up to $660 can be carried over into the following plan year.
Thanks, Victoria.
Oh, and I do want to clarify with David's question about the HSA. So plastic surgery is not eligible under an FSA. That's not an FSA eligible expense.
Great, thank you. I'm new to this procedure. I have seen HSA versus FSA articles online. I saw on the website that this is listed as flexible spending help. Is there a difference? I'm
Yeah,
looking at
so as I mentioned, an HSA can only be enrolled when you have a qualified high deductible health plan. An FSA is something that is separate. You cannot have both accounts at the same time.
Thank you. And I'm looking at our website here. Our healthcare flexible spending accounts, that's our FSA. So that's the same thing as FSA. But the dependent care assistant flexible spending accounts, that's the dependent care assistance FSA. So that's different. So if again, I encourage everyone to just look in our website, and it'll kind of define both on there for more clarification. Another question from Amy: can I use FSA dependent care for my son's preschool if it is taken out of my wife's account? I send her funds through Venmo.
You would have to, yeah, as long as you guys are married, she would be considered your spouse dependent. So either way, if it's coming out of her account, you should be able to get reimbursed for it. I saw an earlier question too about a debit card. Someone asking about a debit card for a dependent. You can order debit cards for additional dependents free of charge. You can do so by either calling customer service or logging on to your online P&A account.
Thank you, Victoria. A question from AJ: would semaglutide drugs be covered as an FSA expense?
Semaglutide.
Sorry, I don't know what that is.
No, they are not considered covered by the FSA.
Yeah, thank you. Question from Sanwa: how long usually does it take to get reimbursement after submitting the claim? Is it online process or should I send an email for approval?
So it is an online process. So if you submit reimbursement and you have direct deposit, your reimbursement will come much faster, usually within 2 to 3 business days. If you would like a paper check mailed to you, you can certainly do so. Obviously, it's going to come through snail mail though, so it does take a little bit longer, but just be aware that there is a $25 minimum reimbursement before a check is mailed out. With direct deposit, there is no minimum.
Great, thank you. Another question from Chris: what is the definition of a high deductible health plan?
I'm not an insurance carrier, so I can't really give like a full definition on that. But it is a different type of medical plan where you do have a high deductible attached to your plan. Yeah, and as Jessica mentioned, you guys do not offer a high deductible health plan.
Yeah, it's basically a PPO plan. where before the plan pays any benefits, you have to meet that deductible. It's usually several $1,000s. That's why they're called high deductible health plan.
Yeah.
Great, thank you. Not seeing any more questions at this point. Just gonna wait a couple of seconds here. Trying to see if I have missed any other questions down here.
There was a lot of good questions today.
Yeah.
Mhm.
Sorry, I was answering a question earlier. The semi-glutide drugs, did you say those were covered or not covered?
They are not covered.
Not covered.
Unless they're prescribed.
Yes.
Okay, so if your doctor prescribed them and you have a copay, you can use it for that drug.
Yeah, it would be considered a prescription at that point. But over the counter, it would not be eligible.
Oh, okay, so like if Costco, I forgot, I think Costco does have a program these days.
Another question just came in here. Are camps that covered under dependent care? I believe they're asking if summer camps and such for their children would be under the dependent care or.
Yeah, so day
so-
camps are eligible. They just cannot be overnight.
Thank you for clarifying that. And that
Mhm.
question was from Amy. Any other questions at this point to our members? Going once, going twice. To check one more time here, see if I missed anything else. Otherwise, I think it's safe to conclude this webinar.
Oh, two more.
Or two more. Okay, great.
Just came in.
Let's see. From AJ, what if the doctor prescribes the semi-glutide product, but it is not qualified under the insurance pre-approval requirements?
So then I would contact our customer service for this type of question, but if your insurance is denying it, odds are the FSA is also going to deny it because it's not going to be considered a prescription at that point.
Great, thank you. A question from Sunwa's son. If I sign up for FSA for the first time, the debit card will be delivered automatically?
Yeah, so for anyone new who's joining the plan, debit cards will be sent automatically before January 1st. Just make sure you're watching out for it because they do come in a plain white unmarked envelope for security purposes. So yeah, after you enroll, I would say look out for it probably around Christmas time.
Thank you. And for the customer service number, Victoria, is that the 688-2611 phone number or?
800-688-2611, yes.
Great, thank you. And I'm just going to drop that here in our discussion box so everyone has it.
Mm-hmm.
We have another question that just came in.
Is the debit card just for health and not dependent care? You should get a dependent care card as well.
Thank you for clarifying that.
But they'll be separate.
Yeah.
Thank you. Any other questions so far?
Oh, for the dependent care, I do want to clarify one thing in that you have to, a lot of times the bills are large, right? I mean, daycare camps, they could be several $1,000s. And so if you're slowly accumulating, let's say you're putting couple $100s per paycheck into the account, you can't actually get your money back if you don't have that much money in your account yet.
Yeah, I was going to point that out too. What you can do is you can still submit the expense, and as the deductions are taken and your account is loaded, we would backdate to that claim. So let's say if you had $2,000 already built up in your dependent care account, you submit a claim for $3,000, we would hold that claim on file, pay you out the 2,000, and then as your account stacks up with additional funds, we would continue to disperse the reimbursements. So a lot of times, most people don't end up using the debit card for dependent care, just because the way that the plan is operated, it's not front loaded.
Thank you for clarifying that, Victoria. Next question from May. Will sports summer camp count as dependent? Incentive camp?
I would call customer service because that's a pretty specific one. I don't believe so because it just has to be so that either parent can go to work. So if it's something that like you're going to physically be attending, a lot of times it's not covered.
And again, if you needed more clarification, you could call the customer service phone number, which is 1-800-688-2611. And asking everyone if you have any other last minute questions before
One more just came in.
conclude. I think that's the cue, is whenever I ask that question is when they get inspired.
And another one.
Action. Yeah, great. Let's see. So does the FSA allow transportation, tolls, parking expenses for medical appointments or at hospitals?
So that's actually a separate plan. It's not under the health FSA. It's a commuter plan, which I don't believe you guys actually offer. Yeah, so you guys don't offer a commuter plan through the city. So it would not qualify under the health FSA. Obviously, your hospital bills and appointments would be, but the parking transportation expenses would not.
Also, I want to clarify, the commuter plan is funds to get you to work, so not to your doctor's
Yeah.
appointments. But that is that's a great question.
It is. That's actually a new one for me.
Yeah.
Next question is from Chris. For orthodontics, will I have the full amount I deduct available as of January 1st?
Yeah, so the health FSA is fully front loaded. So whatever you enroll for will be in your account by January 1st.
You?
And also too, orthodontics is one of those expenses where it can actually be spanned over the course of multiple plan years. You know, I personally had braces and I know, you can have them for 2, 3, 4, sometimes, even more years. So if let's say this year you're putting braces on your kids and then obviously they're going to have them again next year and the year after, you can still utilize the FSA for that expense. You'll have to make a new year election, but the services will still keep being rendered.
Thank you for that. That's a great advice there. Let's see. I don't see anything else in review. Again, I'm calling everyone out. Otherwise, I'll be concluding this webinar shortly. See if anything else pops up. Going once, going twice. Does anybody else see anything on there? No, I don't see any other questions. I think at this point, it's safe to say that we'll be concluding this webinar. And Victoria and Sonali, thank you for joining us today and answering those questions for our members. And for our members, we hope that you found this webinar informative and that you'll join us next year for more webinars, as this is our very last one for this open enrollment. Thanks once again, and remember to submit your changes before tomorrow, October 24th at 5 p.m. And have a wonderful rest of your day. Thank you all.
Thank you guys.
Thank you.
Thank you.